So let us start with the general anatomy today. A few MCQs has been asked from the history of medicine. Very frequently asked who is the father of anatomy, Herophilus, and for modern anatomy it is Andrews Vesalius. So these two MCQs very frequently asked in MCQs. Father of anatomy, Herophilus, and Andrews Vesalius. I think this you are all familiar. Andrews Vesalius is the father of modern anatomy. So with this note, we'll start the general anatomy. So we know the skeleton system consists of 206 bones, where the skull bone is on the cranium will be having 22, 14 plus 8, 14 on the facial skeleton and 8 on the cranial wall. And vertebra it is 26, and ribs it is 12 pairs, if not 24 in numbers. See on the answer sheet whether it is 12 pairs or 24 in numbers. If it is pair, you have to mention it is 12 pairs. If not, it is 24 in number. Only that you have to remember. Sternum, which is a single bone made up of 3 parts: manubrium sternum, body and xiphisternum, fused to form a single bone. On the upper limb girdle, you'll be having 64 bones. On the region, we'll deal the names of the bones. I'm not going with the individual name of the bone in detail. Just time being, you remember how many bones are present on each region. So to conclude, there are 206 bones on the skeleton. So you can classify the bones on the skull as calvarium, which are 8 in number, parietal and temporal, which are bilaterally present, and unpaired bones are frontal, occipital, sphenoid, and ethmoid bone. And again on the facial skeleton, which are present bilaterally, the paired bones are maxilla, zygomatic, nasal, lacrimal, palatine. So they won't be asking you what are all the bones present on the face. Just time being, you remember the number, it is 14. If not, sometimes inferior nasal concha is very often asked, whether it is a separate bone or it is a component of some other bone. Since it is forming a part of lateral wall of the nose, we have 2 more concas, right? Superior concha and middle concha, which are the projections of ethmoid bone. They are the projections of ethmoid bone, really. But inferior nasal concha alone is a separate bone. So for that, inferior nasal concha to be remembered ever. It is a separate bone present on the lateral wall, whereas other 2 concha are projections of the ethmoid bone. So to classify the bones, you can classify long bone, short bone, flat bone, irregular bone, pneumatic, sesamoid, and accessory. You should remember examples of these bones and what are all the features can be present on long bone. If it is a long bone, we'll be having a shaft on the center connecting by 2 ends, an upper end and a lower end. The short bone is similar to a long bone, only the size is different. Flat bone, the antero and the posterior diameters are flattened. Irregular bone, which doesn't have any shape. Pneumatic bone, where it contains air sinuses. If it is filled with air sinuses, it is called pneumatic bone. And sesamoid bone is important since it is developed from tendon. Those bones are developed from tendons. So patella is an example of sesamoid bone, since it is developed in the tendon of quadriceps femoris. It develops only after the birth. It is developed only after the birth by many centers. We have primary center and secondary center. Ossification will be dealing, but sesamoid bone is an example. And again, the covering of the bone is periosteum. The sesamoid bone will not have periosteum. That you have to remember. Features of sesamoid bone: absence of periosteum, developed after the birth, develops within the tendon. One such example is patella, which is developed from the tendon of quadriceps femoris. Fibula is again a one more sesamoid bone which is present on the gastrocnemius, on the calf muscle. That is called fibula, F-A-B-E-L-L-A, fibula. The sesamoid bone present on the gastrocnemius is called as fibula. An accessory or supernumerary bones are additional bones. So as I said, don't concentrate on the text part, you concentrate on the picture alone. Being long bone, it has an upper end, a lower end, a shaft. If it has an upper end, lower end, shaft, it is a long bone. So all the upper limb and lower limb bones are examples of long bones. Short bones. The metacarpals are, it looks like long bone, but the size is smaller. Only that is the difference. If you take an upper limb or lower limb, the size is larger. So long bone and short bone, it should have an upper end, shaft, lower end. The examples of short bones are metacarpal bones, metacarpal and metatarsal bones. Flat bones. All the skull bones are flat bones. Sternum is flat. Scapula is flat. Pneumatic bones, where the bone will be having as sinus, right? We have paranasal as sinuses within the body. So frontal, maxilla, sphenoid, and ethmoid. So what is the function of these as sinuses? They reduce the weight of the skull. Am I right? We have some 2.5 kg of brain within the skull with the CSF. Am I right? CSF is present, brain is present. You have dura mater. Am I right? But you cannot feel the weight of your skull, right? So some factors prevent the